Bismillahirrahmanirrahim. Today our topic is diphtheria. Diphtheria is a potentially serious bacterial infection caused by Corynebacterium diphtheria. It primarily affects the respiratory system, but it can also affect the skin. Here is some information on the causes, signs and symptoms and first aid treatment for diphtheria. Causes. Diphtheria is caused by the bacterium Corynebacterium diphtheria, which spreads from person to person through respiratory droplets or by direct contact with an infected individual's skin lesions. It can be transmitted through coughing, sneezing, or sharing contaminated items like utensils or towels. Signs and symptoms. The symptoms of diphtheria can vary depending on the site of infection, respiratory or skin. The respiratory form is more common and typically presents with the following signs and symptoms. 1. Sore throat and hoarseness. 2. Difficulty swelling. Number 3. Swollen glands, enlarged lymph nodes in the neck. Number 4. Low grade fever, rarely high fever. Number 5. Weakness and fatigue. Number 6. Nasal discharge. Number 7. Formation of a thick grayish white membrane in the throat or nose, which can obstruct the airway. In some severe cases, diphtheria can lead to complications affecting other organs such as the heart and nervous system. First aid treatment. If you suspect someone has diphtheria, it is crucial to seek immediate medical attention. In the meantime, here are some general first aid measures you can take. Isolation. Keep the infected person away from others to prevent the spread of the bacteria. Maintain good respiratory hygiene by using tissues or elbow shoulder to cover the mouth and nose when coughing or sneezing. Supportive care. Provide a quiet and comfortable environment for the affected person. Encourage rest and hydration by offering fluids like water or oral rehydration solutions. Do not attempt to remove the membrane. The thick grayish white membrane should not be forcibly removed, as it may lead to bleeding and more severe complications. This task should be performed by a healthcare professional. Complete the course of antibiotics. Once diagnosed, diphtheria is typically treated with antibiotics like penicillins or erythromycin. It's important to complete the full course of antibiotics as prescribed by a healthcare professional. Prevention. The best way to prevent diphtheria is through vaccination. The diphtheria vaccine is usually given as part of the routine childhood immunization schedule, often in combination with tetanus and pertussis vaccine, DTaP or TDAP. It's also important to maintain good hygiene practices such as regular hand washing and avoiding close contact with infected individuals. Remember, the information provided here is not a substitute for professional medical advice. If you suspect diphtheria or have any concerns about your health, please consult a healthcare professional.